Hi, this is Dr. Zina Berry of DLA. I'm back again with another systems check. We want to make sure that our systems are always being checked, and I got a good one for us today that I had this last week, and I thought it was so good to have this conversation. Sometimes you really know how your staff are interacting with your patients in regards to trying to make sure they explain their benefits, insurance benefits, and your employee is doing their best to make sure that the patient understands the cost and want to go over the procedure. And you've already done your diagnostic information with the patient in the back. So when they're out front trying to go ahead and schedule that procedure, now your front desk person has to be able to be in alignment with everything that's been done thus far to get that patient in front of them, which is to go ahead and make the appointment. However, there's some information the patient needs to understand very clearly before they can make that final decision, because one, there's financial implications. Two, there's an insurance involvement that they want to make sure that the benefit is going to be on their behalf. And of course, thirdly, they want to make sure they're not going to have any pain and the recourse of treatment is going to be satisfied where they have a lifetime of smiles. All of that being said, here is what I really want to get out in regards to making sure your employee and you have an alignment of information. A lot of times our employees are armed with all the knowledge, but when it comes time to execute and talk to that patient, especially when the patient is being a little difficult and not understanding why they got to pay. And it all comes down to that. Why do I need to pay? A lot of times your employee feel as though they need to be able to explain the benefits of insurance, but also take on the accountability if they don't get it approved. It's their fault. It is not your employee's fault. And I try to make sure the employees understand that we are here to offer the services for our employee. We're here to offer our services for the patient, give them options of treatment, and explain to them their benefits as much as possible. When we send in the pre-auth and we get the information back, that's all on behalf of the patient to make sure that they understand why are we doing the services. Your insurance company is definitely on board with it, and this is how much they're going to pay, and this is what you have to pay. When all of those pieces of the pie financially are linked together, you have a better successful outcome. But getting your employee to understand it's not their responsibility to make sure that it's approved. It's their responsibility to make sure the patient understands the work that needs to be done. Because that is where the decision needs to be made, is from the patient. Regardless of the benefit, if it's available or not, of course, we're going to do everything we can to make sure we can maximize their benefit. However, the work that should be done in the person's mouth is strictly the decision based on the dentist's options and what the patient is able to afford and pay for and want as far as a long-lasting result. With that being said, the insurance company is not the major player. They're the minor player. The patient has to make the decision based on their health. And we know this, but getting our staff to understand that is the key component. It's not their responsibility to make sure that it is covered. It is their responsibility to make sure the patient understands why it needs to be done. It's the why. And our employees, they're on our team, so make sure we support and back them up and take away that guilt that they feel in regards to the patient they're trying to take care of. This is Dr. Zina Berry from Dental Leadership Academy.